Hey guys, so in this video we are going to talk about the INI-CET Recall 2025 which just happened today. So I'm Aman Charaniya, currently doing my residency in AIIMS Delhi in the Department of Medicine. So I will be discussing the recalls in short, and along with that I will be giving the analysis of paper of how November 2025 paper was compared to the May, and I will be trying to keep this a short one and not try to go in details. So let's begin, starting with the radiology. So the first question was 14-year-old boy but presented with the pain and the swelling. He had fever, raised ESR, leukocytosis and neutrophilia. CXR was given and that asked the best investigation. So the clinical veneer points toward the osteomyelitis, and the best investigation to confirm the diagnosis among the given option was MRI. Second was that given another clinical veneer in which they asked what is the diagnosis. So even if they don't give the image, you would be able to diagnose based on the veneer, which was involuntary jerky movements of the face and limbs. Here the personality changes, irritability, progressive forgetfulness, coriform movement involving both upper and lower limb. And the image shown here is the classical boxcar ventricle in which is due to the caudate atrophy. So this is the classical of Huntington's disease. So this is the second one. Third question. So in which they had given a 55-year-old smoker, chronic smoker, had drooping of right eyelid, constricted pupil and absence of sweating on the right side of the face. So this is sympathetic change जो है that has been involved because of the compression. So second point was shoulder pain and tingling sensation in the right arm. So this is brachial plexus है वो compress हो रहा है. So basically this is a sulcus, superior sulcus tumor. So they had asked is best investigation to confirm the diagnosis. So obviously histopathological biopsy has to be done. So how will you do the biopsy? So basically the biopsies are CT guided. So this was the answer. Then they had given 42-year-old male presented with a 3 months history of cough which become productive, 1 episode of hemoptysis, and CXR was given which showed infiltrate and the cavities. So basically other options was very vague, and this was the one who had matching along with this. So the answer was pulmonary TB in this one. उसके बाद fifth one was a very classical description of TTN in which they had given a term neonate, not preterm. So term neonate had respiratory distress which resolved spontaneously within 48 hours, and the X-ray showed bulging interlobar fissure. So all this points toward the TTN and not RDS, ठीक है, because RDS preterm में होता है and it doesn't resolve on its own. Then there is a patient with a history of head trauma, 2 episodes of vomiting, and is now unconscious. So what is the appropriate management? So basically this episodes of vomiting is because of raised ICP, which may be because of internal bleeding. So when there is internal bleeding, what approach you do because will be either you do burr hole and reduce the pressure, or you do the craniotomy. So this is the answer for this is a craniotomy. The next one was a 35-year-old man came with the emergency department with shortness of breath, SOB, and CT diya tha. In CT you can see there's so much of air seen over here. So it is basically pneumothorax. So what you will do is you will do needle thoracostomy because it is a it is an emergency. The next question they had, which was a kind of surgery-based question: chronic abdominal pain, elevated amylase and lipase, but normal exocrine pancreatic function. So exocrine function is normal. USG is normal. So USG is normal मतलब pancreatitis would probably been ruled out because USG में if it would have been pancreatitis so कुछ थोड़ा दिखता. MRCP finding as shown below. So here they have shown this MRCP finding in which there are 2 different ducts which are separate from each other. So which is basically seen in pancreatic divisum. In the next question they had just given a spotter and they had marked and they had asked what is this, which was probably the internal carotid internal auditory meatus. Let's move to the pharma. So basically radiology was, I would say, on the moderate, not on the tough side, but it was like easy to moderate one without too much of complicated questions. Moving on to the pharma. So they had given a clinical veneer to the first patient, schizophrenia, which started on haloperidol, now presents with neck muscle stiffness and rigidity. So this is the neuroleptic malignant syndrome. They had asked what is the next best step. So उसमें क्या करना है? It is because of the haloperidol. So stop haloperidol and give bromocriptine because it is a drug of choice in the NMS. So this is the answer. Second is that given sodium potassium ATPase, this drug which acts by inhibiting sodium potassium ATPase, and this diagram. So digoxin, as we know, inhibits the sodium potassium inhibitor, because of which if you inhibit this, less sodium will be going outside and there will be more sodium inside. If there is more sodium, this channel or this pump will also not act because there's already high sodium, so it cannot come against the gradient. And if this is not working, calcium cannot go outside, so there will be increase in the calcium which will increase the force of contraction. And the next one was match the following. Methanol, we know, fomepizole, opioid, naloxone, nalmefil, naltrexone, all these are for opioid. Benzodiazepine, flumazenil, and arsenic. You will use BAL. So BAL is useful for mercury, arsenic, and lead. This is a favorite question of INI. They will ask this again and again in a different way. Next question was the following graph was given. They had given in DRC for ACH, and they had asked when the another drug was given, the drug, the ACH, the graph shifted upward. So basically this is the plus effect. So plus effect is basically seen in synergistic type of drug who adds in the response. Next question, this was the tricky one. I think this question was the one which I would have left if I would have been attempting this one. They had asked that the DPP inhibitor which would require the dose adjustment because of the drug-drug interaction, and given with ketoconazole. So the answer is saxagliptin, but this, as I said, I would just have left it if I would have been giving the exam, because इसमें बाकी ड्रग दिए थे जो कोई लिवर एंजाइम से एक्सिट हो रहा था, जो कोई किडनी से हो रहा था, बट ऑब्वियसली यू कैन नॉट गो एंड रिमेंबर एवरीथिंग अबाउट इट, सो इट्स फाइन. That asked about rifampicin, this is the classical. This first question is true. Resistance is due to RPOB gene mutation, this we know. Second is it undergoes enterohepatic circulation, this also we know. This third, last, P glycoprotein inhibits PBB crossing, might know, I don't know. And but the last question, should be given with fatty meal, is definitely false, because we should avoid rifampicin with fatty meal because उसका absorption कम हो जाता है, ठीक है. उसके बाद the next question was very classic. HIV में there's diagnosed cryptococcus, what is the management? So whenever there's cryptococcus, you give amphotericin B plus flucytosine. See, this question might have a long stem, but what I'm trying to do here is just give you the brief of this question and the answer, because obviously the exam they wouldn't have asked it that easily. They might have given you a question stem and then maybe ABCD वो जो भी किया होगा, but this is what basically the question was. उसके बाद they had this beautiful question in which they told that they are given the crab, so this crab will transmit a disease, then what will be the drug of choice for the disease? So the crab that was given which will transmit what? Paragnomus westermani, ठीक है. So the drug of choice for Paragnomus westermani is praziquantel. So this was the question, which was kind of moderate to tough type of question. उसके बाद they had asked कि what will you drug of choice as ivermectin, they had given combinations of organism. So basically this is the card that I had made in my Anki. So ivermectin is used in onco-filariasis, strongyloidosis, scabies and head lice. So this is जो भी था combination, I think onco plus strongyloidosis था, तो ये जो combination था which will be the answer. उसके बाद they asked about dronabinol. So dronabinol pain management and ये जो है cannabinoid receptor agonist, this obviously we know, but these two options were the confusing one. So it is not excreted in the urine. This was the kind of question in which you would have to take guess, but also I think this is given. I think when I read that AIDS-related weight loss में भी ये use होता है. So this excreted unexchanged in urine was definitely the answer that was there, because it is there undergoes extensive hepatic metabolism. This is a very classic concept. That asks HIV infection in a newly diagnosed TB. So basically TB plus HIV का अगर कोई patient तुम्हारे पास आता है जिनको they have both the things, so ART कब start करोगे? Obviously you will start TB के लिए पहले ATT, then you will take 2 weeks and then you will start ART, because अगर ऐसा नहीं किया then it might get into IRIS, that is iris. So that's why you prevent that. Next question was HIV in pre-exposure prophylaxis in high-risk individual. So this is a very straightforward fact. You have to give tenofovir for plus emtricitabine 300 plus 200 का combination. They ask about which of the following is the true difference between finerenone and spironolactone. Spironolactone, as we know, gynecomastia और ये सब करता है, which is because of the anti-androgen effect and the progesterone-like effect, which is not seen in the finerenone. So that's why finerenone is preferred, and that's why it is comparatively better. VEGF inhibitor पूछा था, because INI obviously will go and ask you this kind of question. I think this both to you guys must have heard about atezolizumab, because ये बहुत बार पूछा हुआ, and pembrolizumab which is PD-PD-L1 inhibitor. So ये तो हट गया. उसके बाद dostarlimab is also this variety only. So this was ramucirumab, whatever like you pronounce it, ramucirumab only. So this is VEGF inhibitor, because this is a classic thing I think to ask in INI-CET. Which of the following is not a side effect of inhaled beta agonist? Obviously what you used in the treatment of hyperkalemia management. In hyperkalemia we give insulin beta agonist का NAB देते ना, तो NAB salbutamol. So salbutamol what it does is it pushes the potassium inside the cell and not hyperkalemia. So salbutamol or whatever beta agonist are used in the management of hyperkalemia because it does hypokalemia. So this was the answer. This question is a repeat property of rifampicin. We had already discussed about that. Moving on to biochem, let's go. So biochem में Gaucher's disease multiple option, as I had already predicted that UPSC वाला pattern multiple answer, this is one of them. सो गॉशर डिसीज, क्रम्पल टिश्यू पेपर अपीयरेंस, वी नो दैट फॉर्म सेल इसमें नहीं होता है. ग्लूकोसेरेब्रोसिडेज डिफेक्ट, ट्रू. स्पिंगोमाइलिनेज नहीं, तो बेसिकली A plus C, B and D किसी और का है. सो आंसर इज A and C. In TCA cycle, the intermediate that serves as a substrate for fatty acid synthesis. So this is also a straightforward fact that citrate will go into fatty acid synthesis, because we know ना TCA cycle में काफ़ी चीज़ें आती है, काफ़ी चीज़ें बाहर जाती है. So citrate fatty acid synthesis we had already studied in biochem. So ठीक है. मैच द फॉलोइंग था, काफ़ी सही था. टायरोजिन, थायराइड, ट्रिप्टोफैन, मेलेटोनिन, ग्लाइसिन, क्रिएटिन, सिस्टीन, टॉरिन तो पढ़ाई होगा एटलीस्ट. सो मतलब दिस टू आई थिंक 12th तक ये दो क्वेश्चन, आई थिंक ये दो ऑप्शन में कन्फ्यूजन होगा, बट सिस्टीन एंड टॉरिन आर द थिंग. ग्लाइसिन का भी क्रिएटिन मेटाबॉलिज्म में पढ़ा है आई थिंक, सो पढ़ाते हैं. तो आई थिंक दिस वाज आल्सो काइंड ऑफ मैच द फॉलोइंग आर यूजुअली इजी, बिकॉज इफ यू नो टू यू विल बी एबल टू रीच टू द आंसर. They ask most common symptom of glucose 6-phosphatase. Now this glucose 6-phosphate will be converted into glucose by glucose 6-phosphatase. If this is deficient, you can't convert this. So क्या होगा? Hypoglycemia होगा. This is fasting hypoglycemia. Tryptophan metabolism दिया था जिसमें they had given xanthurinate excretion. Maybe they'd ask what is it, or they'd ask xanthinuria क्यों होता है, either of them. So xanthinuria, basically whenever there is xanthinuria, it is vitamin B6 पायरिडोक्सल फॉस्फेट का डेफिशिएंसी होगा, जिसकी वजह से जेंथ्यूरियनिक मेटाबॉलिज्म कम हो जाएगा एंड देयर विल बी जेंथ्यूरिया. सो दिट इज B6 क्लासिक आई थिंक. चलो नेक्स्ट, मूविंग ऑन टू द नेक्स्ट क्वेश्चन. ये क्वेश्चन भी काफ़ी बार पूछा हुआ आई थिंक. उसमें देयर आस्क की फॉलेट दे दिया पेशेंट को एंड नाउ पेशेंट इज वर्सनिंग ऑफ न्यूरोलॉजिकल सिम्टम्स. सो व्हेनेवर देयर इज अनीमिया एंड इफ यू डोंट ट्रीट B12 एंड इफ यू जस्ट गिव फोलेट, सो इट माइट हैपन दैट अनीमिया तो ठीक हो जाएगा बट जो न्यूरोलॉजिकल सिम्टम है दैट माइट वर्सन. सो दैट वाज देयर आस्क बिकॉज ऑफ द फोलेट ट्रैप. Length of a transcript is increased only in a cancer cell. This is most likely due to, there are different options, but the best answer that was trying to that was possible for this was the differential polyadenylation, increase in the length of the terminal chain. Mark the correct statement about carnitine shuttle. So the first one was only correct. There are two CPT enzyme in 1 and 2 located in the mitochondrial membrane. Yes, both are located. One is located inside, and the one is located on the outside. ATP जो हाइड्रोलाइज होता है प्रोसेस में नहीं होता है. ATP बाहर ही हाइड्रोलाइज होता है व्हेन ATP इज कन्वर्टेड इनटू AMP. सेल कोया सिंथेसिस जब यूज होता है तब. उसके बाद कोया जो है विच इज रिलीज्ड इन दी माइटोकॉन्ड्रियल मैट्रिक्स एंड दिस कार्निटीन इज रिलीज्ड इन दी साइटोसोल. सो दिस इज ऑपोजिट. सो बेसिकली आंसर वाज A. The next one was rheumatoid arthritis patient है, उसके साइनल टिश्यू में there is increased expression of TNF alpha and interleukin 6 contributing to inflammation. So we have heard that M methylation mutes. So if you methylate the gene, it will mute that expression. But if you inhibit the methylation, तो mute की जगह it will be loud. So it has increased expression. So inhibition of DNA methylation. So that's there. उसके बाद ये एक दिया था कि इसमें से कितने को डायबिटीज़ है. So it's very simple. You have to see fasting जिसका 126 के ऊपर है and जिसका जो 2 hourly है that is more than 200. So you have to see whatever fits into this one. That is the number of patients that are diabetic. So अभी maybe 2 थे, I don't know, like you just जो भी था, but this is the concept 126 and 200. Which of the following is not seen in Conn syndrome? What is Conn syndrome? Primary hyperaldosteronism. So primary hyperaldosteronism, अगर aldosterone बढ़ा है तो सोडियम का क्या होगा? सोडियम भी बढ़ेगा. So obviously there won't be hyponatremia, there will be hypernatremia. Which enzyme defect will lead to increase in 2,3-BPG? So 1,3-BPG usually is converted into 3-phosphoglycerate, but there is an enzyme there. If this enzyme gets blocked, 1,3-BPG will get converted into 2,3-BPG. ठीक है. So this is what happens. So that enzyme is phosphoglycerate kinase. So जिसकी वजह से 2,3-BPG बढ़ेगा, there will be hypoglycemia. This 2,3-BPG is Rapaport looping shunt basically that we have read about. Steps of PCR. Okay, there are questions, easy questions. Denaturation, annealing, extension, that's fine. Doesn't make the whole paper easy. So this was the steps. Plasma magnesium levels are maintained by renal absorption, obviously. That was straightforward question. Uske baad this also had like very vague options, even if you don't read all question and you just see. Obviously bacteriophage, vector, molecular, microbiology, phage expression, inserted gene fragment which we study in phage expression क्या करते हैं वो वाला. ठीक है, तो ठीक है, इसको छोड़ो. During the B cell maturation in the bone marrow, only one of the immunoglobulin heavy chain alleles is expressed in each B cell. You ensure that all the antibodies produced by the cell have a single antigen specificity. So this single antigen specificity is basically called as allelic exclusion, and this occurs because of the VDJ rearrangement of that chain. That again and again with that with the time that the more the time that interaction happens with that antigen, the specificity with the for that antibody for that antigen for the specific antibody will keep increasing. However, even if you don't know anything, देखो alternate splicing करेंगे तो different type of चीज़ें मिलेगी, alternate polyadenylation अलग अलग चीज़ें मिलेगी. So these two options, even if you have not read about, you can rule out. Only two things will remain, that is somatic hypermutation. और तो somatic hypermutation से तो multiple type of ये बनती है antibodies. VDJ rearrangement specificity बढ़ती है basically. A 28-year-old male sudden onset fatigue, ये सब क्वेश्चन छोड़ो. And they are, what is the features of HMP shunt are, कितने करेक्ट है कितने इनकरेक्ट है, लॉन्ग क्वेश्चन. They had asked about HMP shunt. So it does not produce ATP, it generates ribose 5. ये चार ऑप्शन थे बेसिकली. सो नॉन ऑक्सीडेटिव फेज इज रिवर्सिबल, इधर से चालू करते हैं. नॉन ऑक्सीडेटिव फेज रिवर्सिबल होता है, ऑक्सीडेटिव फेज रिवर्सिबल होता है, तो दिस इज रॉन्ग. ट्रांसकीटोलेज रिक्वायर्स TPPS कोफैक्टर, ट्रू, तो दिस इज रॉन्ग. इट जनरेट्स राइबोस 5 फॉस्फेट, ठीक है. O2 एंड NADH, गलत, NADPH होता है, ठीक है. तो एनीवे दिस इज ऑल्सो रॉन्ग, दिस इज रॉन्ग. सो 3, एंड इट डज नॉट प्रोड्यूस ATP, ठीक है. ओके, सो 1 and 3. What is the transport used across? एक image दिया था, they're given an image and they're asked what is this. So basically this is ATP binding cassette ABC, so which is also PGP. So this is PGP, ठीक है. Let's move to the OBGY. This is I think a repeat question. This was also asked in the last, maybe not this May 2024. The recommended timing for postpartum intrauterine contraceptive device insertion is within 10 minutes of placental delivery. This was the answer. I think this is a repeat one. 30-year woman को PPH हो गया, not control on uterine massage, uterotonic, ये सब कर लिया. Then you will, what will you do? Balloon tamponade, that is बकरी balloon, ठीक है. Which of the following is not a marker of ovarian reserve? This is also simple question. Anti-Mullerian hormone होता है, फिर USG करते हैं. USG में क्या देखते हैं? फॉलिकल काउंट करते हैं, राइट. एंड देन अर्ली फॉलिकुलर फेज और अर्ली फेज का FSH या फिर इस्ट्राडायल. ऑब्वियसली इस्ट्राडायल का दिस नो रोल इन ओवेरियन रिजर्व देखने के लिए, ठीक है. So these 3 are the specific thing to check the ovarian reserve in case of infertility. A 30-year-old woman presented with intermenstrual bleeding on pap smear and that atypical glandular cell. What is the next step? Biopsy directly नहीं करेंगे. High risk HPV testing obviously नहीं. Repeat PEP after 6 months, no. There is atypical glandular cell, so you need to do something, and that is you will do colposcopy and endocervical and endometrial sampling, ठीक है. So this obviously this two you can rule out. This is the two things that you have to think about. So cone biopsy directly is better do to check the colposcopy and then to do the endocervical and endometrial sampling. Signs of imminent eclampsia. Standard question: severe headache, blurring of vision, epigastric right quadrant pain. Obviously all of the following are true. In case of uterine inversion, the shock is seen mainly due to. So in uterine inversion, the shock is because of neurogenic. If it is PPH, then in PPH there is hypovolemic shock or maybe because of bleeding. But in uterine inversion, the shock is because of neurogenic shock. This is the true difference. That ask strawberry cervix is a characteristic in the infection of obviously Trichomonas vaginalis. Let's move on. That given कि C-section में कौन सा यूज़ नहीं होता है, and the one of the option was Doyen's retractor. So Doyen नहीं होता है, Devers retractor यूज़ होता है. Doyen's is for laparoscopic procedures, right? So Doyen was the answer. This was not as this easy, that given in a twisted manner, but what they wanted to ask is cesarean section में क्या यूज़ नहीं होता है. And the next question was 30-week-old prima gravida, placenta previa है, mild vaginal bleeding, BP 110/70, heart rate 140. There is no uterine contraction. Which other is the next appropriate step? Since the patient BP is fine, patient complains of mild vaginal bleeding, but she has TAG, still we'll go with admit and manage expectedly, and we'll wait if we need to go for cesarean section, because if the patient is unstable or the fetus is not, fetal arteries are not soured, or if the complication arises, then we need to go for C-section. But if the patient is stable at 30 week, then we will wait and do the monitoring. So expectantly manage करना है उसको. 40-year-old woman present with intermenstrual bleeding. तो एक तो bleeding है, along with that the thickness is 15 mm. Oh my god, classic question. Do hysteroscopy and endometrial hysteroscopy के साथ biopsy करो, because 40-year-old woman more than 4 mm. You do the biopsy and rule out cancer. See this question: for which symptom is the NACO kit not given in men? देखो NACO kit inguinal swelling, urethra, genital abdominal pain वैसे सब में दी जाती है. But if you see the question and read the question, men, obviously abdominal pain होगा. अगर if some person has abdominal pain, you won't give this man, because this abdominal pain का PID kit होता है, which is for women, ठीक है. So as I said, questions are काफ़ी in kind of like how much common sense do you use and how much of the presence of mind you use, ठीक है. Let's move on to the last size. Let's move on to the micro. So micro के questions are very easy this time. Most common cause of viral diarrhea in adults. Adults में it's norovirus. If they ask in children, it is rotavirus. But here they ask about adults, so it is norovirus. Filarial larva is not seen in peripheral smear. तो वो कहाँ जाके sequester होगी, or where will you look for it? So whenever this is not seen in the peripheral smear, they will be in the lung, because if you have studied the maturation cycle, everything goes into the lung and then again get expectorated and come out. So it is lung. Candida albicans can be identified by the demonstrating which of the following. Candida का we have obviously seen germ tube formation for Candida. उसके बाद है a fungal infection of mitral valve shows silver और glomerulus stain positively. Which of the following organism is the most likely? Most likely देखो दोनों मतलब there are multiple organisms, but what of the following is the most likely? So the most likely में see these are the two options which are very close. Candida with aspergillus, that both have silver or GMS stain positively, although faint. But fungal infection of mitral valve are more commonly seen by Candida rather than aspergillus. So it's better to go with option A than B. उसके बाद there are two questions which was very direct. Identify the egg. जिसमें एक एनसाइक्लोस्टोमा duodenal का था, and second image was also in which parasitic fluke दिया था. ये सब छोड़ो, if you just see the egg you will get to know that it is fasciola hepatica. So these eggs are always important. They will come up directly or indirectly. All of the following are acquired via thorn prick except so sporothrix chromomycetoma, but this dermatophycosis skin to skin contact से होता है, ठीक है. And let's move on to the next question. A patient presented with multiple sinuses discharging black granule. See ये सब में discharging तो होता है, but this black is the key here. So Madurella has black. So this is the answer. There are पूरा टेबल है कि किस में कौन से कलर का ग्रेन्यूल निकलता है. आई ऑलवेज थॉट कि ये तो नहीं पूछेंगे, बट दिस टाइम INI had come up with that as well, and they asked that based on the black granules. ठीक है. Then there was match the following. Toxocara canis larva migrans, basically visceral larva migrans they करता है. Ancylostoma duodenale और brasiliensis, this skin वाला infection, that is cutaneous larva migrans. Larva occurrence is basically the fast larva जो एकदम स्पीड में वाला ज़्यादा है, जो strongylate stercoralis हाइपर इन्फेक्शन सिंड्रोम भी करता ही है. एनसाइलोस्टोमा डिओडिनल, ऑब्वियसली दिस इज अ हुकवर्म इन्फेक्शन जिसमें ब्लड लॉस होता है. सो दिस बेसिकली दे आर जस्ट ट्राइंग टू नो दैट आपको डिओडिनल और ब्रेजिलियंस के बारे में भी पता है ना, दैट्स इट. उसके बाद दैट गिवन लाइक अ क्वेश्चन इन विच दैट आस्क स्ट्रेप्टोकोकस निमोनी था, अल्फा हेमोलिसिस एंड रॉड्समैन कॉलोनी अपीयर हुआ, विच ऑफ द फॉलोइंग टेस्ट will you use for its identification? See this is अगर another Anki का card that I had made, basically उसका निमोनिक था bile inulin optochin for strep pneumoniae. सो ड्रॉट्समैन अपीयर्स ऑटोलाइसिस ये सब तो था. तो बेसिकली स्टेप निमोनी में यू नीड टू डू बाइल सोल्यूबल, तो बाइल सोल्यूबिलिटी टेस्ट था ऑप्शन, और ऑप्टोचिन और इन्यूलिन फर्मेंटेशन. दिस थ्री विल टेल यू अबाउट दिस. इनेट इम्यूनिटी का कुछ तो पूछा था कि वाई इट इज़ नॉन स्पेसिफिक, बिकॉज उसका कोई मेमोरी नहीं होता. इनेट इम्यूनिटी विल एक्ट फॉर एनी ऑर्गेनिज्म और एनीथिंग दैट कम्स टू द बॉडी एंड ट्राई टू से भाई please stay away from us. So that is innate immunity. Irrespective of whoever it is, it will try to mount an effect, but it will not be specific, like it will be non-specific. Then they had asked about lab dealing of MTB BSL. So when COVID came, they had asked about COVID in the past, I think, and now after 3-4 years they had again asked this BSL. So safety level 3 use होता है for MTB because it is airborne and it is highly infective. ठीक है. Again they had asked diphtheria that even asked in last not last but उसके पहले के में. So in diphtheria toxin they had asked about incorrect. It is the most toxic known to men. क्या होता है most toxic known to men? Most toxic known to men botulism होता है, diphtheria नहीं होता है. Causes myocarditis 100% true. It is an exotoxin, true. It is toxemia करवाता है, exotoxin and not an endotoxin. Exo-endo पता है ना, endo is like when they are alive. And उसके बाद there is no vaccine is available. Which of the following is incorrect? So ठीक है, toxin तो option A तो definitely incorrect, it is most toxic. तो ये तो definitely correct है, ये दो तो ठीक है. No vaccine is available, DPT तो होता है. Now I don't know these two options. I think if it was a multiple, I think then answer would be A and D. An image shown in the fruit base was provided. जिसमें बेसिकली एक साइकिल दिया था निपा का, उसमें पूछा था विच ऑफ द फॉलोइंग इज करेक्ट. सी 100% केस फेटालिटी, तो किसी का ये 100 मतलब हटा दो, ठीक है. इट्स प्राइमरीली स्प्रेड्स फ्रॉम मॉस्किटो. साइकिल में दिख रहा था कि मॉस्किटो से तो ऑब्वियसली नहीं जाएगा. नाउ द 2 ऑप्शंस रिमेनिंग. सो दिस निपा इज बेसिकली फर्स्ट ऑफ ऑल एन RNA वायरस, ठीक है. paramyxoviridica. So DNA, rhabdo, इसको हटा दो. So fruit bait excess and natural reservoir that we have read about the NIPA. ठीक है. I think Mero had asked this NIPA multiple times in Mero के I think हर GT में NIPA का questions इधर उधर से आ ही जाता है. Then they had given a clinical veneer. उसके बाद ये सब दिया था कि CT में नोडुलर हेलो दिखा, GMS पॉजिटिव था, ठीक है, न्यूट्रोपीनिया था, तो पेशेंट को इन्फेक्शन हो गया. न्यूट्रोपीनिया है तो हाई लाइकली कि फंगल इन्फेक्शन होने के चांस हाई है. व्हाट इज़ दिस? तो ये देखना था कि क्या है, म्यूकर है कि एस्परजिलस है. ठीक है. सो दिस इज बेसिकली म्यूकर. क्लिनिकल क्लासिक क्वेश्चन. ठीक है. आई थिंक इफ द इमेज वाज दिस, अगर कुछ अलग इमेज होगा देन आंसर माइट बी डिफरेंट, बट वही एक्सेप्टेड वर्सेस एक्सेप्टेड. ब्रांचिंग 90 एंगल वर्सेस मोर देन 90 एंगल, वही एक्यूट वर्सेस ऑब्ट्यूज ब्रांचिंग, एस्परजिलस, म्यूकर, जो भी इमेज था. आई एम नॉट श्योर कौन सा इमेज था. एंड लेट्स मूव ऑन टू द PSM. PSM में देर आस्क, ये वाला क्वेश्चन था, 500 people 20 न्यू केसेस ओवर 2 years, बट देर ऑल्सो मेंशन अबाउट द टोटल पर्सन टाइम ऑब्जर्व वाज 950 person. सो यू हैव टू बेसिकली डिवाइड 950 बाई ऊपर रखना है 20 into 100. सो ये अगर सब करेंगे सो बेसिकली 200 बाई आई थिंक 95. सो आंसर वुड कम समवेयर अराउंड 21. So this was the answer. PM 2.5, yes. When you are in Delhi, PM 2.5 is a major concern for your life. So PM 2.5, why is it a concern? Because this is a small particulate matter and it can reach to bronchioles and it can damage your lungs. Okay. A study finding that the reducing the incidence of the cardiovascular disease, कि exercise से cardiovascular disease का risk कम होता है. However, people who exercise also tend to eat healthier diet, and a good diet itself reduces or lowers the risk. ठीक है, ट्रू. सो व्हाट इन दिस कॉन्टेक्ट डाइट क्या है? सो व्हाट दे ट्राइंग टू से इज समवन हु इज एक्सरसाइजिंग विल आल्सो हैव अ गुड डाइट एज वेल. सो जो रिस्क है कार्डियोवास्कुलर रिस्क, वो किससे कम हो रहा है, एक्सरसाइज से कि डाइट से? सो बेसिकली डाइट जो है इज को फाउंडर. सो व्हेनेवर यू आर ट्राइंग टू डू स्टडी, यू हैव टू मेक श्योर दैट एवरीवन ईटिंग a same type of thing and then doing exercise or not doing exercise, and then you have to see whether it is effective. So this is co-founder, confounder, not co-founder. In a study, the p-value was obtained was 0.03. What does this study imply? So जो पावर होता है, पावर बेसिकली इम्प्लाइज कि इतना परसेंट एरर हो सकता है कि चांस की वजह से आ जाए. सो बेसिकली 0.03 इज इफ यू डू इट इन परसेंट, देयर इज चांस कि 3% जो आउटपुट है विच इज़ बिकॉज ऑफ चांस एंड नॉट ट्रू, बट 97% अगर प्रोबेबिलिटी है कि अगर ट्रू आया तो इट इज़ ट्रू ओनली. सो दैट इज़ द पी वैल्यू प्रोबेबिलिटी. Which of the following is not a component of Bradford-Hill's criteria for causation? If you don't know this name, it's fine. Causation क्राइटेरिया तो पड़ा है. टेम्पोरलिटी मीन्स अगर कुछ इवेंट हो रहा है उसके बाद कोई स्पेसिफिक आउटकम आ रहा है, सो दैट इज़ टेम्पोरलिटी. डोज रिस्पॉन्स रिलेशनशिप इज़ कि अगर ये इवेंट जैसे कि एक्सपोजर टू टॉक्सिक गैस या फिर टॉक्सिक एनवायरनमेंट या हाई AQI में आपका एक्सपोजर हो रहा है, उसके बाद आपको लंग डिजीज़ कुछ हो रहा है, और अगर ज़्यादा AQI है तो लंग डिजीज़ ज़्यादा होगा. सो दिस इज़ डोज रिस्पॉन्स, दैट इज़ बायोलॉजिकल ग्रेडियंट. बायोलॉजिकल प्लॉजिबिलिटी क्या है कि AQI ज़्यादा है तो फिर आपको लंग डिजीज़ होगा बिकॉज PM 2.5 होता है, जिसमें अगर PM 2.5 ये चीज़ है जो ब्रोंकियोल तक पहुंचेगा. सो दिस इज़ देयर बायोलॉजिकल प्लॉजिबिलिटी. सो दिस ऑल 3 थिंग्स इज रिक्वायर्ड. सेंसिटिविटी इज़ नॉट अ कंपोनेंट. ठीक है. सो 2 थिंग्स ऑन AQI हो गया अपना. विच ऑफ द फॉलोइंग इज नॉट करेक्ट? द रोल ऑफ फैमिली बियॉन्ड रिप्रोडक्शन. सो बियॉन्ड रिप्रोडक्शन नाम में लिखा है. व्हाट आर द क्वेश्चन वाज बेसिकली व्हाट दे वांटेड टू आस्क इसकी रोल ऑफ फैमिली जो PSM में हम पढ़ते थे. इट वॉज अबाउट कि सपोर्ट करना एक दूसरे को, कल्चरल हेल्थ रिलेटेड बिहेवियर एक दूसरे से सीखते हैं कि व्हाट टू डू, प्रोवाइडिंग इमोशनल एंड फाइनेंशियल सिक्योरिटी. ठीक है. एंड द लास्ट ये जो होता है कि रेगुलेटिंग सेक्शुअल बिहेवियर एंड रिप्रोडक्शन ओनली. बेसिकली दिस वॉज द थिंग दैट यू हैव टू रूल आउट. बाकी तीनों सही है या फिर वट एवर दैट आस्क अकॉर्डिंगली द आंसर वुड बी देयर. विच ऑफ द फॉलोइंग स्टेटमेंट करेक्टली डिस्क्राइब द नीति आयोग हेल्थ इंडेक्स. सो आई थिंक दिस वॉज ऑल्सो मल्टीपल चॉइस क्वेश्चन. It helps and evaluate to compare the performance. Basically it will एक दूसरे के स्टेट के बीच में they will try to compete but in a healthy way कि कौन अच्छा बेटर परफॉर्म कर रहा है. डेफिनेटली इट encourages the healthy competition among the states. तो ये दोनों तो ठीक है, सेम ही हो गया. It supports the policy formulation for improving the public health system. True. It is used for government hospital evaluation only. Anyways, only और ये सब क्वेश्चन जो अब स्टेटमेंट यूजुअली रॉन्ग ही होते हैं. सो दिस इज ऑल्सो यूज फॉर प्राइवेट एज वेल, नॉट जस्ट अ गवर्नमेंट हॉस्पिटल. सो A, B and D are correct. This is false. In a case control study, which of the following statement is true? Matching eliminates all confounders. यहाँ पे वी हैव टॉक्ड अबाउट कन्फाउंडर्स ना कि इफ डाइट, एक्सरसाइज एंड कार्डियोवास्कुलर रिस्क अगर कम हो रहा है, सो इफ़ यू हैव सम कन्फाउंडर इन डाइट, so you have to match equal number of people or equal same amount of diet, So and then you compare exercise. So match agar kar liya same population ko, so it will eliminate the confounder. So the same thing. Choosing hospital control leads to selection bias. Maybe let's just read more. Using more than one control per case increases the study power. I don't know. Maybe case control study provides incidence directly. Case control. See, so I think we just read the options again. True पूछा है ना. So matching eliminates all confounders. I think which will be false. All confounders तो नहीं जाएंगे. फिर भी there will be something that will be staying. केस कंट्रोल स्टडी से इंसिडेंस तो मिलेगा नहीं बिकॉज यू ऑलरेडी नो कि कौन केस है और कौन ये है, तो दिस ऑब्वियसली विल गो आउट. बट दिस आई थिंक बी लुक्स द बेस्ट, नॉट द जस्ट ट्रू, बिकॉज बी के अंदर अगर हॉस्पिटल से यू आर टेकिंग कंट्रोल्स तो सिलेक्शन बायस तो होगा बिकॉज दे माइट नॉट बी द हेल्दी इंडिविजुअल कंपेयर टू वॉट यू आर ट्राइंग टू स्टडी. सो दिस ऑप्शन, दिस क्वेश्चन इज थोड़ा सा ट्रिकी, बट दिस बी इज मोस्ट लाइकली द आंसर आई वुड से. दिस इज अगेन द नीति आयोग. So which of the following is a function of NEET Aayog? So I think I don't know which question was asked actually, but something about NEET Aayog. So population census ये सब तो नहीं है, 5 year plan ये सब. Basically it is about long term policy, जैसा कि पढ़ा था हमने नीति आयोग का. किधर का क्वेश्चन ये रहा, policy formulation for improving the public health system and give strategic input. So this is for NEET Aayog. There was a question कि एक कोई तो हेल्थ केयर वर्कर है, उसको हेपेटाइटिस का वैक्सीन मिला हुआ था, बट अभी उसको निडल प्रिक इंजरी हो गया एंड नाउ द पेशेंट का टाइटर्स चेक किया तो टाइटर्स आर लेस एंड उसको बिकॉज टाइटर्स आर लेस नाउ विल कॉल इज अ नॉन रिस्पॉन्डर. सो व्हाट इज द नेक्स्ट स्टेप ऑफ मैनेजमेंट? शुड वी गिव द वैक्सीन अगेन? शुड वी वेट? शुड वी गिव द जस्ट अ बूस्टर डोज और शुड वी गिव HBIG? So since the person is non-responder and the vaccine will take time to give its effect and the patient has a needle prick injury with the positive hepatitis B positive person, so 2 doses of hepatitis B immunoglobulin need to be given, one immediately and one after 4 weeks. ठीक है, because the person was non-responder, that is healthcare worker was non-responder. According to NPA-NCD, which of the following screening are done? जो VIF और cervical cancer screening होता है, visual inspection for oral cancer, true. Mammography for screening at primary level. So primary level पे breast examination होता है. Mammography are usually at not primary. Primary is basically PHC. So PHC पे तो नहीं होगा. Either at CHC if good CHC is there, or that अगर यहाँ पे नहीं है तो you might have to go to secondary centers, basically district hospital पे होगा. So this primary level makes it doubtful. Screening starts beyond 30 year. I don't know, maybe 30 year. This maybe I don't know, but this mammography at primary level is definitely the true one. So at the end of the video, I would just like to say the paper was, I think I will come out with the another part tomorrow as well. Today I was on the duty, so after that whatever time I got, I just made the video out of it. So tomorrow or maybe I will try to make one more. The paper in general was similar to what I had said. They had given so many close options. It was kind of UPSC type of pattern, which I think INI will hold for some more time, in which they will give you ABC, ABCD. In general, paper was based on PYQ, PYTs as usual, but they were twisted. So this twist makes it kind of moderate paper than easy paper to देखो INI will not give you. So this is the paper which was kind of moderate to tough, or maybe say let's just keep it a moderate one. So PYQ, PYT with in a twisted manner, long stem question, given that the time is 45 minutes for 50 questions. Makes it always moderate to tough only. So I think paper was moderate to tough. The cutoff I think probably will stay somewhere between what the cutoffs or May INI were. So let's see, and just I will give once more after seeing the other questions, and we'll give one more input after seeing the other questions. So till then, if you like the content, just like the video, share it with your friend, and subscribe to my YouTube channel, so that motivates me to make more video. And see you in the next one. Till then, bye bye, and thank you for tuning in.